thank you. And now for our pledge and four-way test, it's Walt Kunow. Walt is an independent writing and editing professional.
Tony, I'm on my tiptoes here. Thank you, President Tony. It is my honor and privilege to introduce a colleague and a good friend of mine, Natalie Harris. For over 30 years, Natalie has been working to address the issues of poverty and homelessness here in Kentucky, both in the nonprofit and the public sector. In the late 1980s, she served as the director of the statewide Homeless and Housing Coalition of Kentucky and the Appalachia Service Project Home Repair Program. For 12 years, beginning in 1993, Natalie was the director of the Specialized Housing Resources Department of Kentucky Housing Corporation. And there, she was responsible for developing, implementing, and coordinating all of the policies and procedures around special needs housing. And she wrote the very first successful Continuum of Care grant and AmeriCorps grant right here in Kentucky. She has served as a consultant to the U.S. Census Bureau, Corporation for Supportive Housing, the U.S. Department of Housing and Urban Development, and the Urban Institute on issues including rural homelessness and supportive housing. Since April of 2010, she has led our Coalition for the Homeless, a nonprofit organization committed to the advocacy, education, and collaboration on homeless issues. The Coalition for the Homeless is a nonprofit organization which is a member organization of over 30 homeless shelters and service providers, all collaborating to help those who need their services the most. And the Coalition for the Homeless has 19 staff and a budget of over $4.2 million. Natalie was also responsible for creating RX Housing Louisville. This is an effort to end veteran homelessness, as well as focusing on those in our community who tend to be the most chronically homeless individuals. In addition, one of her most recent efforts is a phenomenal effort to end youth homelessness with a 100-day challenge to house 100 youth. Natalie is also a grad of Auburn University, and we were talking before, I was thinking she'd be a happy tiger after the game on Saturday, and she is. But you know, most importantly, like me, Natalie is from the South, and she enjoys cooking, canning, and gardening, and she makes a mean watermelon rind pickle and pickled okra. So those of you from the South know what I'm talking about. But what I want to leave you with last is one of my favorite sayings is by Gandhi, and it goes something like this. Leadership used to be about power. It is now about getting along with others. So it is my honor and privilege to recognize and introduce Natalie Harris, who is one of those wonderful servant leaders who requires and inspires us to get along with others for the good of all. Natalie, thank you.
Thank you. Let's see if this works. So thank you for this opportunity. I knew I would be too short for either of these, so I decided to move around and get this type of microphone. I'm not sure after Pam's introduction I need to say much about who I am, but I am Natalie Harris, and I am the Executive Director at the Coalition for the Homeless. And just to give you a little understanding about who we are, as Pam was saying, we have 30 member agencies. Those groups are working every day with very few resources to make things happen for homeless people in our community. They provide the shelter, the housing, the food, the clothing, all those things that homeless people need. So what we try to do is make their lives easier. We work to coordinate their services, and we work to try to make the best use of what resources they have. Every year we apply to the federal government for about $10 million that we allocate into all those agencies to try to feed those programs and make them the best we can. And we do things like bring people together to work on a particular crisis within our homeless world, so that our efforts are more effective. And then the last thing we do is try to make the best use of those resources. And an example would be understanding that homeless people were standing in line for hours at a time to get into shelter. And so we created a single point of entry so that you can call and make a reservation and not have to go through that process to get into shelter at night. So that's a little about who we are. I want to thank you for this opportunity to come and speak today. I think it's important to know about all of our citizens. And when I see this service above self, and when I hear the things that you are doing as this group of people, it's inspiring, and it makes me feel hopeful about the issues of homelessness. And so today I'm going to tell you a little bit about homelessness in the United States and here in Louisville, and maybe that will inspire some future action from the club and all the things that you're doing. So the first number I want to talk about is 83 billion. 83 billion is a big number unless you work in the federal government, and then it doesn't seem like such a big number. And 83 billion was the amount of money that was spent in the Department of Housing and Urban Development in 1970. And so I think it's important to talk about this because we forget that all of the crises, all of the issues that happen in our country and in our community are caused by something. They don't just happen. And so if that was what we were spending in 1970, beginning I think it was in about 2000, that number was cut in half, or actually was cut in fourth. And then it rose a little, it went down, it didn't matter whether it was Democratic or Republican administrations, it continued to be much lower than this and has just now risen in 2016 to $50 billion a year. So you can imagine all those years of not spending money on housing, that's how we end up with the homelessness that we see. I tell people that in the 70s, I grew up in Birmingham, and I saw a few men who were on the streets of Birmingham and they would show up in the shelters, but I never saw families with children and single women who were having to use the shelter system. So we can all talk about lots of problems there were with public housing and some of the other ways that we were using housing money back there, but we didn't see the kind of homelessness we see now, and that lack of funding is a lot of why that is. We can talk also about the cost of going to college and some of those other things that have also attributed, but that's the biggest cause. The second number is a local number, and this number is how many people were homeless here in Louisville in 2016 over the entire year. Some of those people were homeless for only a day. Some of those people were homeless all year long and multiple years. So we maintain the database of homeless people here in Louisville with all of those different providers that we work with, lots of community volunteers, and when they all put their data in, that helps us understand how many people were homeless here in Louisville. But the exciting news is that the next number is 9,130, and that is the number of people in that same database who were homeless in 2010. So things are getting better in Louisville. A lot of that has to do with the economy. People are being able to get jobs. You can see from our statistics that there are some neighborhoods that are faring better than other neighborhoods. So there are some people who are homeless in our community, or who are in our community, who are more likely to become homeless depending upon what neighborhood they live in. But overall, we had a 2,757 member decrease in the number of people who were homeless here in our city over that 5-year period, which is about 460 less every year. So there are some things that are working well, and then other areas where we have a lot to do. So a little bit more about this, how did we end up with people who are homeless when we live in such a great and generous country? And the biggest part about that is that that 25% is the percent of people who are eligible for housing assistance. That means they make so little that they are eligible for public housing or Section 8 or other kinds of housing assistance. 25% is how many actually receive it. So that explains why we have a waiting list of 21,000 people waiting at Louisville Metro Housing Authority to get assistance. So there are many people who would be eligible for those programs if funding were available. Additionally, an important number to understand is $15,080. Many of us talk about minimum wage and we talk about $7.25, but it's hard to really think about what $7.25 means. For me, it's a lot easier to talk about $15,000. So if you were working full-time, if you got that many hours and you were working minimum wage, that's how much money you would have. And so if you're talking about possibly having a child, trying to not only just pay your rent, but also drive a car and clothe your family and all of those things, you can imagine how difficult that is to do. And even if you're making a little above that, if you're in the $20,000 range, you can imagine how difficult it is just to pay your bills. And that's a lot of our healthcare workers, a lot of the people who work in daycare, a lot of those kinds of jobs. And so we see that those kinds of families are not homeless for a long period of time, but come in and out of homelessness when they have one bill, like a car problem, or somebody has to go to the hospital, and they have to decide whether to pay that bill or pay their rent that month. So $17 an hour is what we would actually need as a citizen here in Louisville to pay a 2-bedroom apartment and just your basic expenses, nothing extravagant. This doesn't include daycare or additional expenses, but if you wanted to be able to comfortably pay your rent and your utilities and feed your family and all of those things. So I don't know how many of you have talked about this in the meetings, but here in Louisville we have 35,000 jobs that are unfilled. So I think a big part of what we need to do as a community is figure out how to make that price point work in more of these jobs. And the second part is make sure that our citizens are skilled enough and have the skills that they need for those jobs. So I think that's a big opportunity. I think because of the economy, if half of the people who are in shelter are actually working, we have a great opportunity to help bring up the skills of those people and make them able to fill some of the many jobs that we need as citizens to be filled. So I'm going to talk a little bit about some of the subgroups. Pam alluded to the fact that we have a program called prescription housing, and that is because we believe the prescription to homelessness and to many of the physical and mental problems that homeless people have is housing. And there was a doctor in Boston who actually wrote out a prescription for a homeless person, and he said, fill this, one apartment, refilled every month until needed. And that really does make a lot of sense. There was a health study presented today here in Louisville, and they talked about the health results of poverty and homelessness and those types of things. So what we have been able to do is change our focus through prescription housing and focus on certain populations. And the first group we really did focus on were the chronically homeless, those folks that are on the streets for over a year and have a disability. By doing that, we were able to decrease the number of chronically homeless people on the street by 60%. We have not eradicated chronic homelessness, obviously, but that was a big step in the right direction. And we have just recently received about 55 vouchers that will help us continue along the lines of being able to address that. Probably the most impressive thing that we've been able to do through the prescription housing program is that in 2015, definitely because of the leadership of the US VA, our local VA administration, and Volunteers of America, but about about 24 partners in all. We were able to house 838 homeless veterans in this community. If you had told me that we would be able to do that in a year, I would have been questioning it. I wouldn't have taken that bet. But I feel really good about that partnership, and the most exciting thing about it is that we have reached what the federal government calls functional zero, which is a term to mean that we are now housing veterans in Louisville at the same rate that they become homeless. So if you know of homeless veterans in this community that are homeless, please tell them to reach out to the local VA and Volunteers of America. We have actually reached the point now where the number of new homeless veterans is going down. This year that number went from 25 to 19 every month that become homeless in our city, and those groups continue to house them at that rate. Whoop. Sorry, I got a little crazy there. So less than 10% is an important number because the most visible homeless people that you see in any city, not just here in Louisville, are those chronically homeless that I was talking about. And we do have them in Louisville. I did talk about that fact that that number has gone down, but they are in Louisville less than 10% of our homeless population. The majority of our homeless, the 90%, are individuals and families, many of them single parent families that are those people that are right on the cusp. They're working minimum wage, they're working part-time, and all it is one thing. They end up becoming homeless, they come in and out of homeless, and the average length of time homeless for that group is about 3 months. Unfortunately, they still live pretty precariously, and so those folks can come in and out of homelessness over time. And this leads to one of the main problems we have in Louisville. One of the groups that isn't doing as well as families. We lost a lot of shelter and transitional housing for families 2 years ago, about $1.2 million in federal funding. We did get that amount of money back, but it went toward chronically homeless, which means we have a real gap in family services and family shelter, and we now have a 2-month waiting list with 40 families here in Louisville waiting to get into emergency shelter. They are not waiting for housing, they are waiting for emergency shelter. So we have a real gap in that area. The other area where we see a gap is youth. The number of homeless youth in the country continued to rise and rise. Fortunately, we've reached a point as the economy's gotten better that it has capped, I hope, and is actually decreasing. But we feel like this is the most important group now for us to be focusing on. We know that if you do not catch somebody by the age of 24 and get them engaged in work, education, the arts, something that is going to engage them in our community, the chances of them living off government subsidy for the rest of their lives increases exponentially. So it's important for us to engage these people while they're young, invest in them, and help them find those keys to be those $35,000 people who are going to fill those jobs. And so we did on August 1st. We were one of 5 cities that made a challenge to house 100 youth in 100 days. Again, I don't know that I would have taken the bet on how well we would do, but thanks to over 20 local partners working on this every single day and meeting weekly, we were able to achieve that goal. In fact, we housed 115 youth in that 100 days, and we're very excited to celebrate that. The one thing I will say, though, is unfortunately we still have homeless youth in our community. We have a by name list that we maintain daily to keep up with who still needs to be housed, and there are 112 young people here in our city on that list, and we know there are many other young adults who are precarious and could end up on that list again. And so we are doing many things. We would love for all of you to join us. I have to say, I was glad to see that Barry Allen is here today. The Gaines Foundation was the very first funder that helped us on an effort to create a host home program in the community. And so we are planning to finish up the fundraising for that and start that effort soon. And we're looking for people in the community that would like to help meet some of that shelter gap and host a young person between between 18 and 24 in their home for 1 to 3 months while that person gets housing. We think this is a great model for Louisville because it keeps young people out of the shelter system and out of situations where 40% of our homeless young adults are sex trafficked or sleep in their cars or other precarious kind of situations. And so we have a lot to do. You now know where we're doing well and where we're not. And I thank you for this opportunity to share and hope that you'll keep us on this challenge for the future. Thank you. Thank you so much. Yeah.
It is time to take some questions for Natalie. You mentioned the 112 youth that are being tracked. Does that also include tracking whether or not they're attending school and what schools and so forth?
Yes, so we have a 4-part plan. We're working on housing, but we also are working on mental health and other support systems, education, and employment. So all 3 of those are key, and we try to assess each one of those youth to determine what's the right path for them.
Thank you.
Hi, I'm Julie Schmidt with KET, and my question has to do also with the youth. I'm just curious, is the population somewhat, can you categorize them? Are they children that have aged out of maybe a home that they've been living in, or characterize who the children are? Or youth, I should say.
Yes, so part of our plan, and I should have said when we are talking about youth, we're talking about anyone who is 24 or under. For those youth that we housed and that we're tracking, they're 16 to 24. And we do, from that homeless database and from working with our other partners, know that about 1/3 of those youth are LGBTQ. About 1/3 of those youth are young parents already. They're either parenting or pregnant. And over half of that population are minority youth who live in neighborhoods where they have a lot less opportunity than the rest of our city.
Thank you.
Hi, Natalie. Thanks for an informative presentation. Leland Woodmansey. Before my retirement, I was on a team that looked at the chronically homeless, and they're bouncing from prison or jail to hospital to shelters and costing the community an inordinate amount of money. And I know some efforts were being put in place to coordinate services to those top 50 familiar faces, as we called them, but I haven't heard much about that. So was that part of the reduction in chronic homelessness, or what effect has, if any, has that had?
Yes, you are right. We've done several studies with U of L and actually with U of L Hospital as well, and Family Health Centers. Wellspring has done a study, and all of those studies show even with the cost of housing counted, you save about $19,000 a year on those chronically homeless people who are in those systems all the time. But the problem is it's hard to take money from one system and give it to another system to solve this problem. It's hard to take money from the jails and the hospitals and give it to housing developers. But there have been some efforts. Centerstone has done a lot of work on a program with the jails to identify their high utilizers, and they actually are starting a second tier of those groups, or of those people that they're identifying and housing. Their familiar 50 is what they're calling it, I think, or familiar faces. And we also have been working with Passport to identify those really high utilizers in healthcare. There are people who are showing up at the emergency room over 200 times a year. And you know what an emergency room bill costs, and if you're doing that 200 times a year, just by working with the hospital to try to identify ways to house those folks, we're saving, just U of L Hospital over $1 million a year when you can house 22 people. So yeah, we hope to continue that effort to figure out more ways that we can share data and identify those people and house them.
I'm Deborah Hoffer with Junior Achievement. Thank you so much for your comments and for your work. I think it's so important. I have two questions. They're both related. I think you'll answer them pretty quickly, but they're both related to JCPS. Number one, how do you interface and work with JCPS to identify homelessness? And number two, I think your definition of homelessness is different from the Jefferson County Public School definition, because I hear them say 10,000 or 10% of our kids are homeless. So will you explain that, please?
Yes, and so there are two different departments who define homelessness differently. For the Department of Education, they are really focused on education and what are the things that keep a child from becoming educated. And so they are focused on children who are unstable in any way. So they do include kids that are doubled up with family and friends and grandma and whatever, which the Department of Housing and Urban Development is simply focused on who needs shelter and housing, and so they are only looking at people who are on the streets and in shelter, or are in their car or some other place not meant for human habitation. So the numbers that I use, so just imagine if we had 6,300 people who were homeless last year, if you added the people who are doubled up and all of that, that number would go up much higher. And we work really closely with Giselle Danger, with she's the homeless coordinator for JCPS. She's the hardest working woman I know in Louisville. I don't know how she does it. In fact, she really struggles to keep up as one person dealing with the number of homeless children that there are in our school system. But she does a great job, and the hardest job she has is to make sure that those kids actually get to stay in the school that they were in, to try to make sure they get a good education and aren't moving all over the place. There was a federal law passed last year, which is supposed to give those same rights to children exiting foster care. Right now, a lot of those kids go to institutional schools and are taken out of their home school. And so we're working with a group of advocates to try to make sure that our foster children get the same rights. And the JCPS now has a director for those children as well.
Thank you.
Good afternoon. I'm Fred Cowan, retired circuit judge, and my question is related to, once you get some of these folks out of a homeless situation and start them on the road to getting back in the mainstream and being stable, what is your biggest challenge? I'm sure there are many. What is your biggest challenge, and what specifically are we doing to make sure that they stay not homeless?
So it depends on the group that we're talking about, but I think probably, with children and young people, it is that engagement. It's, helping them, mentoring them to get to get your education, to get employed, to figure out that piece. But for most people, when they ask that question, they're really talking about the chronically homeless, and that is a really hard transition. If you've always lived in a house and have never been in that kind of situation, it's hard to imagine, but people who live on the streets for a long time learn how to excel in that situation, and it's a whole different set of rules. For example, one of the things that I learned about people who live on the street is, and this also happens in third world countries, that what you learn to do is share whatever you have. That is the best thing that you can do for your survival, because later you're not going to have something and somebody else will. So if you shared when you had, then you are going to get when somebody else has. That's a terrible rule when you move into your own apartment and you're trying to figure out how to pay for your groceries and all of those things. So we do try to focus on supportive housing when we are moving chronically homeless people into housing, so that they have a case manager who is working with them as much as they feel comfortable with. And usually that person then kind of weans off over time as they become comfortable in that. I think it's also important for them to have group meetings so that they can talk to other people who are struggling with this same situation and find friends that are part of that housed group, rather than bringing their friends from the streets into their apartment and causing lots of other problems by having people who aren't in the lease in their apartment. But yeah, it's a struggle. It's a transition for people.
Thank you.
Thanks for the questions, and thank you, Natalie. That was a marvelous presentation. Very important.
Thank you. Thanks for the opportunity.
Before the band closes us with another song, a reminder again, please, by midnight tonight, make your $25 minimal donation to the Rotary Foundation. Keep in mind that this year's challenge is for each of us to donate $100 personally to our own Rotary Club of Louisville Fund, our fund, and another $100 minimal gift to the Rotary Foundation. This $25 will go against that $100 level for the foundation. Also, as I was reminded before the meeting, with so much talk and work and activity with regard to tax reform, it's a great time to consider a year-end gift to Rotary in various capacities so that we can make sure that we get the deductions that would ensue. So earlier we heard from our band in honor of the late departed Tom Petty, and now Fats Domino also. We lost Fats in 2017, and so here is an honor to him as well. Blueberry Hill. And our meeting is adjourned.